We are joined now by Professor Kelly Ormond, Chair of ASHG's Social Issues Committee. Thank you so much for joining us.
Oh, thank you, Sloan.
Tell us the mission of this committee.
Well, the Social Issues Committee is part of ASHG that sort of monitors the landscape of impact. So we have all of these amazing research studies going on, and that is ultimately turning into impact in the clinic, and many of our members do that. So what the Social Issues Committee does is we think about that broader societal impact of the work that we're all doing in the laboratory and with patients.
And that's so important. You've played a key role in developing ASHG's position statement on a few issues, including non-invasive prenatal screening. Tell us your position and how you reached that position.
Yeah, well, first I think it's helpful to know a little bit about non-invasive prenatal screening and testing. And in the past we've had blood tests that the mom could have that would give her a risk estimate for whether or not a baby was likely to have things like Down syndrome. And you could alternatively opt for invasive tests like an amniocentesis that would give you a yes or no sort of answer. And that had a risk, and the blood tests weren't that great. So non-invasive prenatal testing improves our ability to give moms some of that risk information without putting their baby at risk. So it's really been a tremendous new thing that hit the market about 3 years ago. The position statement really looked at three core things as this technology evolves. The first is the notion of always trying to balance benefits and harms. So it's not a perfect test. We don't want people to assume that when they get a high-risk result that their baby has one of these medical conditions and rush off and make decisions based on that. We want them to know that there is still a chance of false positive and they should get that checked. We also think it's great that many more people can access this technology, but we're cognizant of the costs financially and access issues around it. And then I think we're also conscious of the notion that this is just going to sort of snowball in terms of what we can test for. So if there's no risk to you to get information, who's to say you should stop with things like Down syndrome or trisomies that may have really significant medical impact? We can theoretically sequence the fetal genome, and who gets to decide what's okay to test for?
You've also updated the position when it comes to a number of different issues, including genetic testing in children and adolescents. Tell us about that.
Yeah, so back in 1995, ASHG created a position statement about testing children, and the landscape of testing was just so radically different back then. I mean, I could probably count how many genetic tests were available back then. And now, it's amazing what we can do. So we thought it was very important for the society to update our position on what we can do here. And the main principle from that original statement still stands. So that is the notion that, and if you have children, you would probably think about this, as a parent, you get to make many decisions for them, and your child doesn't have the capacity to make those decisions. But as they become adults, that capacity grows. For some of these things that happen in adulthood that we can do testing for, we want the child to actually be able to decide whether or not they would want to know that piece of information. And if you as the parent do that testing, you sort of take that ability away from them. So we're certainly keeping that as the central component, but allowing a little more flexibility, because we know that in some families it may actually be the right decision to do that testing. So providing that support.
What issue is the committee working on now?
Well, you know, one of the most interesting things going on right now, I think, is the topic of genome editing and how that has suddenly become very realistic to do in a more clinical setting in the near term. So we're trying to think ahead to what social issues are going to arise, and we've only just started that process. So I would say stay tuned, and next year at this time we can talk about that issue.
Very complex issues that you are dealing with. Kelly Ormond, thank you so much for joining us.
Oh, thank you. It was a pleasure.